This is the Trinity Broadcasting Network celebrating our 25th anniversary.
Welcome to this segment of Calling Dr. Whittaker. As if you were with us on the last program, you know that my guest had been Harold and Lois, and they were with me as patients from Jefferson. And you know, the Holloways, they had lost 100 pounds between them. Harold had lost 60 pounds, Lois had lost 40 pounds, but they'd lost 100 pounds. Remember, we were talking to them, and it was not a diet. It was a nutritional change. It was a lifestyle change. And they never will gain this back because they're continuing to be on a lifestyle change. 100 pounds between Lois and Harold. Now, I have in the studio today a guest that will talk to you about nutrition. He will talk to you about things that's going to help you. He's no stranger to TV. He does TV all across the country. He does TV in England, and I'm going to let him introduce himself because he's Italian. And he says, even though I'm Italian, he says, I have trouble with Italian names. But I have more trouble than he does, so I'm going to let him introduce himself.
Good to meet you, Don. My name's Dr. Privitera.
Privitera.
Of course, out in Italy, it'd be Privitera. So
here, a good Catholic lad, huh?
Here it's Privitera, and I just love the ornateness of this TBN studio. This is what we old Catholics are used to seeing. Mm-hmm. I'm glad it's coming back in the other denominations. It's a welcome sight. It's very visually positive.
See, God is such a fair God that whether you're called Baptist or Methodist or Catholic, as long as you believe in the Son Jesus Christ, as long as you believe in the blood, He doesn't care what we're called, as long as the only way to the Father is through the Son.
That's right.
Tell us a little bit about yourself. Where did you graduate? I have a book here that we're going to talk about.
Graduated from Creighton in Omaha, Nebraska, and interned and residencied up and down the state, Stanford, and then Scripps Clinic for some fellowship in allergy and rheumatology. So then I got interested in dark field microscopy back in 1977.
Okay, now remember we have some people out here that are not exactly sure. So what is dark field?
It's a method of looking at the blood with a microscope called dark field because the field is dark. So you're going to, Dr. Don has a normal in front of him. So
all right, now what are we looking at?
We're looking at a normal red blood cells on a dark background. So,
right, so these circles are normal red blood cells.
Right, and that's what they're supposed to be, nice and round, not indented.
All right, now you understand that the Word of God says the life of the flesh is in the blood. The life is in the blood. So this is what you're looking at, is you're looking at the blood.
That's why it's good for doctors to look at the blood, because the life is in the blood, and people like to know. We have a very wondering populace out there. They're wondering what's wrong with me, and we can show them. So we can take a drop of blood on a microscope and hook it up to a TV that didn't exist 100 years ago and show them their own blood, and they love it. This is a test that they frequently ask to see again. In other words, if they had problems with their blood, if they had platelet aggregation or clotting, or if they had antioxidant deficiency or deformed cells or poikilocytosis, if you're in the medical profession, then they want to see it again. They want to see it get better. They want to see a before and after. Just like you're talking about the weight thing. People want to see a before and after.
All right, now what are we looking at here? Now
this is a big clot.
Okay? And you're talking about a blood clot.
That's a blood clot, otherwise called in big parlance, in medical parlance, thrombocyte aggregation, platelet aggregation. It sounds like a conspiracy that we give you 3 names for something, but that's just the way it is. We got Greek, we got Latin, and we got English. So what happened is, a lot of times there's 3 names for everything in medicine.
But now that was a clot.
That's a clot, and that's a big problem in society, because even though throughout the world, like in the world, the biggest cause of death, of course, is infectious diseases. Mm-hmm. But here in America, the biggest cause of death is heart attacks and strokes, especially heart attacks. So heart attacks is first, strokes are second. And like I was showing Dr. Don, that even today in the paper, I looked at the LA Times, and here's a fellow, they say he walked through a market, 57-year-old, he was the foreign correspondent for the LA Times. He just fell over dead, silent. And the title of the book I'm
now
showing,
we're looking here at a book. It's called Silent Clots. What do you mean by silent
clots? Silent clots. In other words, a lot of people, most of them who have heart attacks and strokes, these are silent. They have no warning, no chest pain, no headache, nothing. They just fall over dead. So what we're trying to do is get dark field microscopy in the emergency rooms and have doctors throughout the world do this very inexpensive test, like we charge $30 in our office to do this test, to see if they have excess clotting, so that then they can intervene with biblical treatments such as fish oils, garlic, oil, magnesium, and herbs like feverfew. God's treatments are there. They're very effective. Cayenne pepper is a very effective one, by the way, Don. So on page 10, I have a whole list, and also the proanthocyanidins, otherwise called grapeseed extracts. So these beautiful remedies will keep your blood thin and prevent the biggest problem we have, which is excess clotting.
And see, it's not just in the male. It's also in the female.
And talking about that, when you think of females, sometimes you think of the word hysteria. And when you think of hysteria, I think of Philippians, which says, be anxious for nothing. And anxiety and stress increases adrenaline and causes excess clotting. So God also tells us in Luke, men's hearts will fail them, okay, when they see various bad things like El Nino and terrible natural disasters, which are happening now. Okay, what's going on? Adrenaline makes platelets stick together. When they stick together, they form clots. Clots cause heart attacks and strokes. All we got to do is look at the blood. We can see the clots.
Now, you're telling me here in this book, Silent Clots, you're telling me here in this book that you have a testing that you can run, and it costs, in your office, it's only cost $30.
And
I mean, that's nothing. I mean,
right.
And you can tell whether a patient is more apt to have a heart attack than not.
Absolutely. And any emergency room, I'll tell you the story. I had an emergency room doctor come to me. He had chest pain. He was told he had costochondritis. And
a costochondritis, inflammation of, and not infection, but inflammation of the bone here.
Where the ribs go into the sternum,
right,
or the breastbone.
Right.
He was told he had this costochondritis, so this arthritic type condition, and he supposedly had an EKG, he had stress tests, he had an echocardiogram, blood test, and they didn't show anything. So they said, well, you've got costochondritis, you're going to just have to live with it. He came in my office because he was interested in holistic medicine. We looked at his blood, and sure enough, like the book, he had a big clot, like shows on the book here. So what we did was...
what he had then is what we had right here, is that right?
Right, he had a big clot.
But now it was solid.
A big solid clot. But you have to use dark field microscopy to see these clots, because dark field is angled illumination, and kind of like an X-ray will bounce the light off these platelets, and then you'll be able to see them. So he had a big clot. We gave him right there in the office. We gave him some heparin under the tongue. Heparin's a natural blood thinner that's found in the lungs. So we gave him some of that. We gave him some fish oils. 15 minutes later, his chest pain was gone. We looked at his blood again. His clots were gone. Okay, so
what was actually happening then? Tell us.
What actually was happening is his lifestyle and his, whether it was also his spiritual makeup, he was causing excess clots to exist.
Do you think part of this has to do with the soulish spiritual makeup? Is that right?
Absolutely. The people, one of the biggest things, I mean, you can look in a phone book 10 years ago and you look at a phone book now and you'll see psychologists have a huge increase number in the phone books. So we know there's tons more psychologists now. We know people are having more stress now than they had 30 years ago. And it's, of course, because they've gotten further and further away from
God.
From God, exactly.
They got farther away from God, farther away from the Word of God, and stress continues to increase.
Right, and we know that married people live longer than single people because there's less stress. They have somebody to talk to. And so I think there's a 7-year difference between married and single.
Exactly.
So we know these things. So stress is one of the biggest killers. I'm not just trying to say the answer is nutrition. It certainly isn't. But smoking, and sugar, and deficiencies, okay, and a lot of
When you say deficiencies, you're talking about vitamins, minerals,
yes,
trace elements, magnesium, antioxidants,
magnesium. Deficiencies in the grapeseed extract, proanthocyanidins.
How many of that book?
It's all on page 10.
Yeah, well, I want to let me look back here on the back of this book.
Here's all the deficiencies.
We're talking about emergency room doctors. We're talking about doctors, orthopedic surgeons. We're talking about all types of MD specialists. We're talking about specialists that are in the emergency rooms. We're talking about specialists. We're not talking about, and there's not a thing wrong with a nutritionist. I'm not saying anything wrong with a nutritionist. I'm just saying these are MDs, these are doctors that deal with life and death, and they are saying that silent clots can be prevented in a large percentage of cases.
Absolutely. So if people can't access, let's say, a dark field microscope, even though they're everywhere, all it takes is, we were talking